Abortion in Tennessee, a true women's health disparity. Research conducted by Ashley Carr, RN, BSN, future family nurse practitioner. "93% of Tennessee is considered rural. Access to abortion providing facilities in Tennessee is inadequate. 96% of the counties have no available facilities, and 63% of women live in these counties. There are only 11 abortion providing facilities, and only 7 of those are true abortion clinics. In the last 30 years, Tennessee has made 21 amendments to abortion laws, all intended to place more restrictions. Healthcare providers can refuse to participate. There's a 48-hour waiting period for a woman from the time she receives in-person counseling until the time she can undergo the abortive procedure. Minors must obtain parental consent prior to surgery, and the public funding is limited to life endangerment, rape, or incest of the pregnant mother. Tennessee's newest amendment is called Tennessee Infants Protection Act, and it is placing restrictions on viability. So basically, you cannot perform an abortion after 20 weeks unless it is a medical emergency. The procedure must be performed in a healthcare facility with appropriate neonatal services, providing the infant with the best chance of survival. At 24 weeks, the fetus is presumed viable. So what's the problem? By placing the new restrictions on legislation, there is now a lack of accessible facilities. A woman in Tennessee has to look elsewhere to get these services. By doing that, it's increasing her cost of travel, lost wages while traveling, childcare expenses, and with the 48-hour waiting period, that requires 2 trips to the healthcare facility. There is also lack of state funding, leaving the woman responsible to cover all costs. That is difficult to obtain when 42% of women having abortions are below the federal poverty level. My suggestion is to prevent unintended pregnancies. Patient education on family planning and various types of contraceptives available is key. Contraception has to be consistent, effective, and affordable to ensure that the patient is going to be compliant, therefore reducing the number of unintended pregnancies. By doing this, we are ultimately reducing the chances of needing abortive procedures. So what else can we do? We want to remove the stigma and shame associated with having an abortion. As healthcare providers, we should not be judgmental. We are patient advocates. If we are not going to perform the procedure, we need to refer to a higher level of care to allow the patient the best chances of positive patient outcomes. We also want to review legislation and determine the necessity of the restrictions. We need to look at the quality of care and patient safety. So in conclusion, as a healthcare provider, whether you support the legislation or oppose it, it's important that services are available and affordable to all women. As emotions are heightened due to the recent passage of stricter abortion laws in other states, the window of opportunity presents itself to allow for more restrictions to be placed on legalized abortions in Tennessee. As healthcare providers, we must advocate for our patients and provide comprehensive health care. We must provide evidence-based teaching to promote family planning, thus reducing the need for abortive services. We need to come together. We can reduce this women's health disparity.